Joining us now, Tony Ann Richards, CEO of the HCC Network, a collection of 6 community health centers serving rural areas of Missouri. And Terrence Meck is president and CEO of God's Love We Deliver, a New York City-based organization that provides meals for people with severe illnesses. We were just talking about Congressman Johnson, who says that the impact of Medicaid cuts have been overstated. Tell us about your program and what it could mean.
Absolutely. I mean, this is going to be devastating for the thousands of New Yorkers who rely on medically tailored meals for the illnesses that they're going through. I mean, we serve over 4 million medically tailored meals to over 17,000 New Yorkers each and every year. These are people living with chronic and severe illnesses that would not be getting these services otherwise.
Would you consider it to be life-saving help, potentially?
Absolutely. I mean, this is how we face hunger and malnutrition. And they're not going to get these services otherwise. I mean, what we do keeps people out of the hospital. Our research has proven that 70% less likely to go into the emergency room, 52% less likely to be admitted to the hospital. What we also do is that 2 nights of hospital stay actually cost 1 year of feeding people medically tailored meals. I mean, that is a huge healthcare savings, and it keeps them alive.
You have actual statistics about where that money goes.
We absolutely do.
Yeah, Tony Ann, rural Missouri, it presents obviously a different set of challenges. How would you assess the healthcare system where you are? Because we've talked a lot about rural hospitals, but what's the role that you play, and what would these cuts to Medicaid mean?
Sure. So we're a federally qualified health center in West Central Missouri, and it would be devastating across the board. And I'd like to just respond a little bit to the representative's comments that rural people are extremely, and safety net people in general are very concerned about responsible spending and committed to taking care of our communities. And we also want things that are done right. And in order to do that, we have to be able to take care of people. And so this particular bill would hit Missouri to the tune of 27%. Additional people would lose Medicaid coverage. And we went through a redetermination process like many others a year and a half ago. And we had several people that were already kicked off of the system because we could not find them. Re-enrollment processes were challenging and difficult. And so another 27% loss on that adds to our uninsured bottom line. The reality is that we're going to still take care of people. They still need some place to go. We just won't get paid. We just won't get paid for the work that is still going to need to be done.
Tell me what you're hearing from the community. Is there an awareness of what is potentially going to happen, and what are they saying?
Sure, they're anxious. They're very anxious. Not only our patients, but our staff are anxious. Our community leaders are anxious, and it's really because we do want to step up. We do want to take care of people. We want to be able to ensure that we have a quality system, a quality, safe place for people to go so they can access care. Much to what you just heard on the social care side of things, there's also the fear of the loss of food access, transportation, childcare. The list just goes on, and it continues to compound with every dollar lost. And not to get into a whole lot of detail, but the provider tax issue and how it will hit the state of Missouri is also very complicated. But it will limit the amount of dollars that are even available for the Medicaid reimbursement program in general.
I wish we had time to talk more to you both, but I think it's been an important response to what we just heard, an important way to help people understand what's at stake here, beyond maybe what's have garnered some of the headlines. So, first of all, thank you both for the work you do, and thank you for taking the time to come on the program. We really appreciate it. That's going to do it for us this hour. Make sure to join us for Chris Jansing Reports every weekday, noon to 2 p.m. Eastern, right here on MSNBC. Our coverage continues with Katie Tur Reports next.